Hello everybody, we're back with another session. Thank you so much for joining in. Hi Maheshwari, just wait a minute and then we can start. Okay, now that we have a lot of people who've joined in, so welcome to Expert Dialogues with Carmesi. This is in collaboration with Motherhood Hospitals, and together we are trying to create information which is reliable and on women's health. And we're also trying to bring pertinent topics to the forefront that need attention. So today's topic is infertility, and we have a lot of questions that we've received from you yesterday, like the most common ones being what are the risk factors that can cause infertility, then what are the pre-existing conditions that can lead to infertility, as well as the most important one being how do you break the stigma around not being able to conceive. So to address all these questions, we have with us Dr.Preethika Shetty, who is a consultant obstetrician as well as a gynecologist from Motherhood Hospitals, to kickstart the discussion. So let me just have her on, and then we can start. If you have any questions, please do not hesitate to put it on the comment section. Hi, Dr. Preethika.
Hello, hi, good evening.
Good evening. How are you today?
I'm good, dear. How are you doing?
I'm also doing good. So,
Nice.
Doctor, before we start, can you tell us a little about yourself? How
Yes,
has your journey been?
I'm Dr. Preethika Shetty. I'm practicing as a gynecologist and infertility specialist at Pune, Motherhood Hospital. So, my interest is like pregnancy care, infertility, and any gynec-related issues. I've done my post-graduation from Armed Force Medical College, Pune. So, presently practicing here.
Okay, amazing. So, Doctor, starting with the topic, the main question, which is what exactly is infertility and how would one recognize that?
Actually, that should be a first question exactly. Like there are certain couples who try for 2, 3 months and then they get panic. Are we really infertile? And they come. And there are certain couple think that okay, sab acha hai, we are doing good and we'll wait for 2, 3 years. So both ways it's not good. By definition, infertility means when a couple try without any kind of protection for an year or so, and if they're not able to conceive, then they are into the group of infertile couple which who needs evaluation and appropriate treatment.
Understood. So, Doctor, how common is infertility among women as well as among men?
Yes. So infertility prevalence, if we say, it ranges from 5% to 15%. According to statistics, they feel rural areas the prevalence of infertility is around 5 to 7%, and urban area it's around 10 to 15%. And out of the 100 couple who are getting infertility treatment, like in general, always the onus is on the lady. Okay, they are not able to conceive, तो उसमें कुछ तो problem है. The lady has a problem, but it is not like that. So around 20 to 25% the female factor contributes, 20 to 25% male factor contributes, 25% of the couple, it is both of them. There can be problem in both of them. And 25% all said and done, there can be no obvious cause and still they may not be able to conceive. So this is in general the prevalence rate or incidence of infertility.
Understood. Thank you, Doctor, for bringing the statistics out for everybody to know. And like you said, that the onus comes on the woman. That why aren't you able to conceive?
Yeah.
So a very very important subject I want to touch upon, which is before we actually move into other questions on infertility, can you shatter the stigma that is attached to infertility and also talk about the issues that women face for not being able to conceive? One of them being actual name calling for not being able to conceive.
Correct. Yeah. So that actually the era has gone compared to what was it for 15, 20 years. Fortunately enough, everyone is educated. So things are better. but still at certain part of India or certain religions or certain home cultures, there is a pressure on a lady. So first thing should be, it is couple's choice. It is their choice whether they want to go for further treatment, but to what extent they want to go for treatment. There are certain couples, even if they're not able to bear the child or if they are not able to conceive, there's so many options like adoptions are there, surrogacy is there. They can concentrate on other part of their life. The family life is not the only point. Only point, right? They can concentrate upon career, their hobbies. So that's also okay. There are certain couple, if everything is fine, still they do not want to have their biological side. So that is also fine. Now, focusing on the couple who wants to try but they're not able to conceive, first and foremost is their confidence is low. So first point I want to put across to all the viewers is, do not feel bad or do not take the burden on yourself. It is normal. It is like any other health condition. You get a malarial infection, do you blame yourself? No. So it's same way. So accept what it is. Understand where do you fall into the infertility range, whether it is a mild form, moderate form, severe form, what kind of treatment you would require, and go ahead. Yes, there will be pressure from the partner. There can be pressure from yourself if the person himself is not confident. They can be, basically it happens because of comparisons. There can be pressure from family members. There can be pressure from society, but they should be strong enough to bear all that and go ahead. So
Yeah.
the stigma, social stigma, what is there is absolutely wrong, and we should get out of it and should make it open and free.
Thank you so much, Doctor. I think the way that you've explained this is absolutely fabulous. It is definitely the couple's choice, not anybody else to actually comment on it, or for one of the person in the among the two to feel the pressure that it's because of me that I'm not able to conceive or something like
Exactly.
that. So thank you so much for bringing that out, putting it out for everybody to know that this is a stigma and it needs to be broken. So,
Yeah.
doctor, moving on, are there any symptoms of infertility in both men and women that can be kind of talked about, so for that, for people to know?
Yeah. See, symptoms means, yeah, symptom is presentation as infertility. You are not able to conceive. But
Hmm.
there are certain conditions where we can predict that they might get problems when they are trying for conception. Like, for example, in a male, if they are not able to perform their sexual activity, if there are any erectile dysfunctions, if there are ejaculator dysfunctions, if they are having premature ejaculations, or if they've already had any surgeries on their gonads, or if they have undergone any kind of radiotherapy or chemotherapy for whatever reasons, or any surgical procedures, so, or genetic thing. So these are the people whom we can predict that, yeah, there can be some problem in semen quality. So they might get problem when they get married, or if they're married when they plan for pregnancy. Coming to a female part, getting a regular cycle means generally you're ovulating well, you're releasing your egg on time. So if you're having delayed cycles, maybe due to whatever reason, it can be PCOD, it can be thyroid hormone related problems, or it can be hormonal problems, it can be due to their weight or any factor. If they're having delayed cycles, or if they've already undergone any kind of surgeries, or any sometimes the childhood cancers, they would require kind of chemotherapy, radiotherapy, and that time these advanced techniques were not so much aware of. So if those ovary preservation or oocyte preservation, those techniques are not done that time, so we can expect their fertility potential will be low. And very important, tuberculosis or TB, what we say, even if it affects lung or intestine at any point of their life, that can have impact on the sexual performance as well, and also in the reproductive capacity. So these can be the things we can predict they might get a problem, but
Hmm.
as such symptom will be that inability to conceive.
Understood. And doctor, can STD or STIs hamper the ability to conceive?
Yes, of course, STD, STI can have a problem, but not all. Now, if we say STD or STI, there are a wide range, starting from a simple yeast infection of the lower genital tract to extensive tuberculosis or extensive pelvic inflammatory disease. So do not panic if you have a yeast infection, you will be having problem to conceive. It depends upon what kind of infection you have, at what stage it is diagnosed, and what effect it has on your tubes or your genital organs. Not all STIs will cause problem, but yes, STI is one of the reason for infertility.
Okay. And doctor, is there a definite cause of infertility?
Yes, there are many definite causes. I just would like to explain, like in a pictorial way.
Sure.
The conception or forming a
Can you
baby,
just,
or
doctor, can you just put it a little up so that we can see clearly? Yeah, this is, I think,
is
better.
that fine? Yeah.
Yeah,
It's fine. Yeah.
yeah, this
Um,
is.
so see, the reproduction or procreation or forming a baby is such a beautiful process. Simultaneously, it's a very intricate process as well. It's very important. Like I usually take little time in their first visit whenever infertility couple come to make them understand what are the requirements to conceive and where do they stand. Like what has been evaluated, what needs to be evaluated. So at every step of consultation or every step of treatment, it gets easier for them to grasp. Otherwise, it will be just on papers and they wouldn't understand anything. So, coming to the definite cause of infertility, we need to understand how the fertility happens, right? So, in a very short, in a few seconds, I'll just explain. So, what happens? This is the ovary where the female eggs are formed. Generally, in a lady with everything being normal, around 12 to 14 day of her cycle, she will develop a good sized egg, which is having a mature oocyte. We say it's a good quality of female egg inside that will be released and captured by this tube or fallopian tube. At the same time, when they have a sexual intercourse, the sperms travel all through this way and reach that egg over here.
Can you keep
The
it a
light
little center, doctor? Yeah,
is that
there's a
okay?
visibility issue. Yeah, this is fine if you can point and also make that clear. Yeah, this is
Uh,
better.
so
Yeah.
the, so the life of the egg, which is there from the release till it reaches the tube, is only for 24 hours. So
Okay.
all the crux is between timing of that ovulation or timing of intercourse to for the sperm to meet the egg in those 24 hours.
Hmm.
Then rest of the cycle ahead or beyond that, you keep contact or you keep intercourse, it is not going to matter. So basic what we say is fertile period, or nowadays girls track to the menstrual calendar and they get those apps and all. So it all focuses upon timing of intercourse during that 24 hours. So once a intercourse is there or a contact is there, sperm stay in body on an average for 2 to 3 days. Eggs stay for 1 day. So those 4 days are very important. So all said and done, if a good sperm reaches the egg, the embryo baby will be formed. That comes to the uterus here, stays there, and this is what we call as endometrium or uterine bed. That is also very important. It should have grown to adequate size, adequate texture to accept the baby which comes here and let it grow. Everything is in synchrony. If all well, the baby will start growing here, and in another 14 days, we will get to know either she's pregnant or she's not pregnant. Right. Now, coming back to the question of definite causes, the first and foremost causes the male factor, as I said, around 20 to 25%. If the semen quantity and quality, if it is not good, they may not be able to conceive. If the ovulation doesn't happen on time, or and if they're not able to time it, or if ovulation doesn't happen at all, especially in a severe form of PCOS, obviously she'll not be able to conceive. If tube's function is not good, it may be open, but it may not be doing its work of propelling these things forward or backwards, then also she'll not be able to conceive. So any tubal blocks and again any reasons with the uterus. So these are the common and in general definitive causes for infertility. Evaluation or test related infertility also depends upon this, and treatment what we decide for a couple also depends upon this. So understanding this is very important. Semen, uterus, tubes, and ovulation, and egg quality and semen quality. That's most important thing. Hope I'm
Doctor,
clear.
you've made it so clear that it's been such an educated journey for me also, learning from you. So I'm sure that people who are watching, this will really help them.
Thank
So, doctor, you were actually mentioning the statistics that in rural areas it's still lesser, like they're still able to conceive more, but in urban areas there's a gap. So, can you tell us why that's the case? Are there more risk factors when it comes to urban areas?
Yeah, possible reasons is age of marriage. Generally, rural areas, the age of marriage is more, and in urban areas, it is late. Age of planning for pregnancy, it is earlier in rural area, and in urban areas, it is late. And maybe substance abuse like smoking or nicotine exposure, maybe more in the urban area. Stress, sleep quality, and many more things. Maybe that is the reason.
Okay, understood. Doctor, we have two questions from the viewers. They've asked, can dysmenorrhea make a woman infertile?
See, there are multiple reasons for dysmenorrhea. If it is a primary dysmenorrhea without any reasons, obviously it cannot make you infertile. Dysmenorrhea is due to some huge fibroid lying on the uterus, or if it is due to something called as endometriosis, or if it is due to PID, and then secondary to that, it can cause to infertility. But just because you are having pain during periods, do not worry.
Yes. And doctor, can UTI have any direct or indirect impact on fertility?
No, UTI is basically a urinary tract infection. But if it is secondary to sugar, diabetes, or any other reasons, then it can have. But generally, no. You need not worry on that.
Okay. Sneha, we hope that this is clear now. And doctor, we received a question yesterday. Somebody asked us, can it be difficult for someone to conceive if they have a baby once?
Yes, it like not always. Every pregnancy is different. Like if you have a previous pregnancy, whether it is ended in miscarriage or they could do well and they had a live baby. When they try for second pregnancy, as I explained you last time, the entire cycle gets new only. So that gets affected by other factors as well. So there are many couples who conceive very easily first time. They take a gap of say 4 5 years. When they try for second time, they can be difficulties. It is not all and none that you have had one baby, there'll not be any problem second time. It is not that way.
Okay,
So if
okay.
at all couple wants to plan for a second baby, better to not to delay a lot and go through all the procedures like a first pregnancy itself.
Understood. Doctor, you're talking about delaying and you also mentioned about age when we were talking about the comparison between rural areas and urban areas. So you're saying that age can have a direct relation on fertility, and is it difficult to conceive later?
Yeah, it might look little harsh, but yes, age has a note on fertility capacity. Especially our Asian race, it's known that after 35 years, the number and the quality of female eggs gets reduced at after 35 years. Okay, it's not that they stop producing eggs or the quality, the quantity and the quality gets reduced. So
Okay.
chances of conception when you're trying between 20 to 25 and when you're trying between 35 to 40, yes, there is a difference. So that is one thing. And with age, maybe there was already a pelvic infection before. As the years progresses, it gets worsened, right? Or if there is an endometriosis, as you delay the years, it gets worsened. And if you have any habits like smoking or anything, so initial times like you've just started and within a year or two you're planning to conceive, maybe that time it is better. After a prolonged effect, it gets cumulative and yeah, like logically, age does have a
Does
greater
have
role
an
on.
impact.
Yeah,
Okay.
it's for both, female or male, for both of them.
Understood. Dr. Devyani is asking if there were a couple of years where your period stopped due to hormonal issues, does that increase the risk of infertility?
See, everything is fine. There's no reason that period should be stopped. Periods is stopped because of some problem over there, some hormonal disturbances. So unless you correct it, there can be a problem in conceiving. And we know it is only because of hormonal issue they're not able to get periods. So if we correct that, I think it should be fine. She should be able to conceive.
Okay, Devyani, we hope that this is this is clear for you now. Doctor, somebody asked us yesterday, suppose a woman married and is career oriented plans to have a child later. Is there any process that she needs to go to preserve her eggs?
Yes, like basically they started it for these girls who had to undergo chemotherapy for whatever kind of cancers or radiotherapy for any kind of things. So they are known to have their number of eggs lesser on later date. So we have started something called as egg preservation or ovarian tissue preservation. So
Okay.
those options are there even for the married girls or unmarried girls who want to marry later and plan for pregnancy. But just because that option is there, there's no point delaying. Unless if other circumstances are doing well, I think instead of going through all that process, better to plan on time. Okay. And if there's one test called as AMH. That's a blood test. It gives relative indications that what is your fertility potential. So if those values are good, then you need not go for preservation procedures also.
Understood. Doctor, what are the main treatment methods for fertility? If you can touch upon that.
Yeah. Basically, it depends upon what is the cause for infertility. So, if it is a male factor infertility, we work upon improving the semen quality and quantity. There are many antioxidants tablets available. First and foremost will be lifestyle changes for both of them. Good exercise, diet, stress-free life, accepting what it is and having a, like, when they come to a doctor, they should feel good. They should feel positive. That's the first and foremost treatment modality. And then coming to addressing the issue, what is there? For men, we give certain antioxidants, vitamin E supplements. And when they have hormonal problems, we can supplement them also with the hormonal tablets. There are certain mechanical devices when they are not able to perform the sexual act. And sometimes, if the sperms or the male egg, if at all it is not able to come out of this testicle, there are certain surgical procedures also like testicular aspiration, testicular biopsy. So these are the variety in the male partner basically. Certain men have a problem of like there'll be no spermatocyte ever, not in the semen, not in their body. In that case, we can go for donor sperm options. There are many donor semen banks available, so we can go into that. And coming to the female partner, if it is a tubal factor, depending upon the severity, she can go for surgeries. And if it is only ovulation problems, there are medications and injections to increase the egg formation and monitor the ovulation. And accordingly, we'll ask them to keep contact and or higher procedures are something called as IUI, that is intrauterine insemination, wherein we take the male sperm, wash it up, and inject into the uterus. And then IVF is there. There's something called as ICSI, which is the advanced form of IVF, and surrogacy. So many options are there. Donor eggs are available for the girls who are like the AMH is very low, the egg quality and quantity is too low, then or certain genetic problems if it runs in the family when a male or female partner cannot give their contribution in terms because of the genetic diseases. So lot many options are there depending upon the condition of the couple actually.
Understood. Doctor, can these treatment options have any side effects?
Side effects in the sense, whatever medicines we give, no, that is generally to stimulate the ovaries, and we cannot start with a higher dose at a go. Patients needs to have patience. We start with the low dose and then step up. Sometimes it can happen that ovaries get stimulated, or we say the hyperstimulated. That can be little risky to the body, but doctor takes the responsibility. They would be monitoring you, and in case they feel any point of time if that side effect is happening, they'll do the needful at right then. Second important side effect is multiple pregnancies, like they can be twins, triplets, because they not everything is not in our control, right? So that is the one more side effect. And third side effect is burden on your pocket.
Yes, somebody actually did ask us that, how expensive can IVF and even surrogacy be? So we did receive a question on this. So you're saying that it can be expensive.
Yeah, it is expensive because of the medications, the lab maintenance, the instrument maintenance. So when they have to go for IVF, it is expensive. But lesser than that, IUI or normal treatments are not that expensive. It is worth having it instead of delaying.
Got it. So, doctor, talking about stress, because in today's world we have a lot of stress. There's career,
Yeah.
there's family, a lot of things, finances. So, how is stress linked to fertility?
See, the conception or whether it is male or female, it's all a game of hormones, right? Like what period, what time of your menstrual cycle, what hormones should be there. This is all controlled by brain. Now, brain is monitored by our stress and certain internal hormones. So, if you take lot of stress, the hormone balance will impair, and then you can have problems in conceiving. At the same time, if we learn to like segregate things, the work life as a different, family life different, and not take too much burden on ourselves and keep ourselves cool, things gets easier actually.
Understood. Doctor, can diet have an impact on the ability to conceive? I mean, does it have a relation?
Yes, that has a हम है जो हम खाते हैं, so diet has a very good role on that. So basically, good diet in a sense, good antioxidants, keeping our immunity well also helps us to conceive better. You can get exposed to good sunlight, vitamin D3 supplements, vitamin E supplements, and less of maida and bakery products, control on your sugar intake, good vegetables, salads, fruits have lot of effect. Lot. There are so many patients, like especially girls with PC, who have conceived only with lifestyle modification, only with good exercise, diet, and control on weight. So many patients. So it has major role, major role. It helps the treatment also to get acting faster and
Work
lesser
faster.
duration. Yeah, yeah, yeah.
Understood. Doctor, we spoke about dysmenorrhea and we also spoke about UTI. Are there any other gynecological issues that can impact fertility?
Yes, so commonest is PCOD with a lot of hormonal disturbances, endometriosis, they can be, as I mentioned, you tuberculosis and fibroids. If they are on the way of the reproductive system and if they're too huge, they can cause, and recurrent infections, pelvic infections, these all can have impact on that. And if
Okay,
you're on
understood.
certain medications
Yeah.
like antipsychotic medications, antidepressants medications, these also can have an effect.
So, doctor, but these are all curable, right? They're all
Yeah,
workable
yeah, all,
and
yes,
work through
yes,
all of that. So people
yes,
need not worry or get scared. And
yeah. No, they should get aware and they should start the treatment. Do not worry.
absolutely. And doctor, very coming to a very important point, which is how, I mean, what impact does infertility have on the psychological well-being of couples? We have discussed the stigma part, but can you emphasize a little more on how it can affect, and how can counseling play a role in this?
Yes, counseling plays a major role, major role. Counseling maybe in terms of medical condition, what they're going through, how we are going to treat them. Second thing, making them understand that patience is required. As I said, you, it's a game of those 3, 4 days only.
Yeah.
So if we miss that, then that entire month is gone. So every time they get periods, they get disappointed. So that level of disappointment we want to reduce and make them accept and go ahead with the treatment. So counseling plays a major role, and there's so many like peer pressure, social pressure. They should be strong enough to withstand that and go ahead with as it is.
Absolutely. And we should also encourage people to not pressurize,
Yeah,
especially partners to also not pressurize their partner, because it gets very difficult for anybody to, sustain in that situation.
yeah.
That is important.
But
And counseling, like you're saying, that it is also a very
well,
important part of treatment. So people should cater to that.
yeah.
Doctor, we received a question yesterday again about COVID vaccines. Can these have an impact on fertility treatments? And
No.
I mean, when should a couple go for vaccination if the IVF procedures are going on?
Vaccine doesn't have as such any impact on the fertility because they're either kill vaccine, they're not actual live vaccine. So they can go ahead for COVID vaccine at any point of time. Better is you complete your vaccination schedule and go for the treatment. That is still better.
Okay, okay, understood. So it doesn't have it won't
No,
hamper the treatment.
no, no.
Okay, understood. Doctor, there are some 2, 3 comments that need your attention. First is, can IVF babies have health problems?
IVF babies, like any pregnant woman when she gets pregnant, there is chance, like as a statistics, there are 3 to 4% chances that baby can have anomalies or genetic disorders. So even with IVF, the same thing stands. There's not a big difference between whether it is IVF baby or a naturally conceived baby. Yes, tubal pregnancies, what we say, ectopic pregnancy, that chances are a little higher when you conceive through IVF.
Understood. So, more questions on IVF actually. Can IVF, I mean, is IVF a very painful procedure?
It is not physically not so painful. Psychologically, if you're not well prepared, then it can be a little painful. So being aware and accepting and going ahead is very much important.
Understood. Doctor, another statement, IVF is the only option for infertility treatment and has 100% success rate and can resolve all infertility. What do
No,
you
no, not at all. There are many more modes like lower versions of IVF. There's like so many people conceive with normal treatment. So IVF will be the last option, or IVF will be the only option for ladies with tubal blockage or ladies with very low egg reserve. So for them, it is the only option. But for most of the population, it is not the only option. And the second question, see, we cannot compete with the nature. So giving 100% is very difficult. On an average, 30 to 60% is the success rate with one cycle of IVF. But that again depends upon the individual's physical state.
understood? Doctor, how can, I mean, can sustained usage of birth control pills have an impact on the fertility?
No, no, no. That is a major myth. In fact, to certain hormonal problems, when we give birth control pills, and when they plan to conceive, no, these birth control pills will regulate the hormonal imbalance, and it gets easier for them to conceive. In fact, so please know, whoever wants to go for birth control pills for whatever reason, please go ahead. There's no issues.
Great. I think this has also been a very common concern that we've received from women. So thank you for clearing that out. And Doctor, last two questions. Somebody asked us today morning, I recently had a miscarriage. When is the perfect time for me to try again for a baby?
After 6 to 8 weeks, after you have a miscarriage, wait for another 1 or 2 periods and go to your doctor, check if there are any obvious reasons for miscarriage. Start folic acid supplementations right away, and after 2 months, you can start planning for pregnancy.
Understood. Okay, Doctor, last question, which is, are there any non-medical approaches such as relaxation or meditation techniques that can help in conceiving?
Yes, yes, it helps a lot. Non-medication, again, exercises, diet control, if at all stress-induced a factor is there, relaxations, breathing exercises, pelvic exercises, so many things. It definitely helps to conceive.
Okay, so I think this can also help a lot of people who don't majorly want to get into medication. So people can try that out. And any last comments before we end the session?
So take home message, yeah, though we have spoken on infertility, let us go, prevention is always better, right? So whenever a couple wants to try for pregnancy, do not wait for 1 year to decide whether you're infertile or fertile. Go for a consultation pre-conceptional. So that doctor will talk to you, examine you. If they feel there is any problem at any point of time, they'll get certain tests done and it can be corrected, and then you try for pregnancy. So that is the important message I want to give at the end of the session. So everyone try to have a preconception consultation and checkups.
Thank you so much, Doctor. It has been such a great session, especially that you busted so many myths. I'm sure that a lot of people have, a lot of myths have been clouding their minds, and you've made it totally clear. And most importantly, you've broken the major stigma regarding, I mean, that revolves around infertility. So thank you
Mm.
so much for that.
Thank
And
you.
we hope to have you again for our session. This was absolutely wonderful. Thank you.
Yeah, sure. Yeah, many more viewers, if they have any kind of questions, they can access back to me anytime.
Absolutely. Like Dr. Preethika has said, if anybody has any questions, you can DM it to us, write it in comments, and we can get it checked by Dr. Preethika. Thank you so much again, Doctor.
Thank you so much.
Bye bye.
Thank you. I really enjoyed it. Thank you.
Absolutely. Same here. Bye.
Bye.
Thank you everybody for tuning in. This was a very educational session, and Dr. Preethika was absolutely wonderful in explaining properly what goes on, what doesn't go on, and the main take home message should be that there shouldn't be any stigma around infertility. It is okay. Please do not pressurize your partners. Please do not name call anybody. And if somebody chooses not to have a child, that is their choice. It is nobody else's business. So thank you again for being a part of the session. Do let us know what you want to watch next, and if you have any questions, do not hesitate to send a message. Bye bye.